Jaundice. It's not a problem we think about very much in the United States, but in much of the world it's a serious medical condition. If left untreated, it can cause deafness, cerebral palsy, brain damage, or even death. 12% of infants in the US have severe jaundice, but almost all are cured with the flip of a switch. Simple blue light phototherapy cures the condition in days. 12 million babies need phototherapy treatment every year. But in too many parts of the world, babies are being left in the dark. And they're left suffering from the devastating consequences of this easily treatable condition. Why don't babies everywhere have access to simple blue light? Because traditional phototherapy devices cost more than $3,000. Worse than that, bulbs burn out and replacements are expensive and hard to find. Through a ground-up design process, DREV is working with Phoenix Medical Systems, the leading maker of neonatal equipment in India. We are completely rethinking phototherapy. Our first product is Brilliance, a low-cost, highly effective LED light therapy system.
The magic of Brilliance has been that it can take the LED lights and provide a light source that costs about 50 cents. That's about 10-fold cheaper for a day of treatment to change the course of a baby's life forever.
The LED lights in Brilliance provide more effective treatment and last longer than traditional bulbs. We designed Brilliance to the highest standards, with a price tag that medical centers all over the world can afford, putting the power of a cure in the places that need it most. Brilliance makes it possible for doctors and nurses everywhere to provide families the freedom from jaundice that every person in the world deserves. At DREV, we believe Brilliance will change millions of lives. Our goal is to eliminate the impact of jaundice worldwide by 2022.
Eliminate the effects of jaundice worldwide by 2022. This is DREV's ambitious goal. Jaundice is the #1 reason why newborns are readmitted to hospitals worldwide. In just 4 years, will we see Brilliance transform the landscape of neonatal healthcare across the globe? Let's take a look at the state of jaundice treatment today, with a particular focus on India. India carries the single largest share, between 25 to 30%, of neonatal deaths in the world. A baby born to an East Asian family is at a higher risk of becoming jaundiced.
Brilliance is also tested to have a higher irradiance level compared to some of the world-class devices right now. Irradiance level can increase the effectiveness of phototherapy and decreases the time used for treatment. The LEDs consume much less power than the traditional bulbs, and this can minimize the greenhouse gases produced by almost half a ton per bulb. The annual energy consumption for an LED bulb is also around 30 times less than the traditional bulb. Other than the bulbs, this product actually promotes clinic and hospital development in rural areas. Another social impact for this device is it works with an Indian manufacturing company to do all the production. This facilitates local company growth and creates local jobs. It also brings in the LED phototherapy technology to local medical companies so they can make future developments. It also creates better distribution and reach for rural areas in India. For this device, we also created more training sessions for the medical staff. This actually helps with one of the rooted cultural practices they had before. For example, many parents do not want to show their baby's private parts in front of the lights. And with training and more convincing, now they are able to show the complete baby skin to receive active treatment. And this is very important for the effectiveness of the treatment. But of course, nothing is perfect. There are also some potential negative impacts and risks to our product. For example, Brilliance is only providing a treatment device with no actual measurement for jaundice. And without the correct blood tests, many rural areas may just diagnose jaundice with some eye tests just to look at how yellow the skin is. and this can be very inaccurate and cause over or under treatment for the baby, and that can lead to eye damage. Another one of the problem is after the LEDs wear down, they are even harder or more expensive to replace. And when the actual product breaks down, it will be left completely useless and harder to repair. And of course, we have initial training for the product, but there could still be ineffective use after that. When there is a lot of babies that need treatment, many hospitals are taking shortcuts and treating more than one at a time. This can lead to cross-contamination or even worse side effects. Putting the light too close or too far away from the baby can also affect the effectiveness of the treatment. Another one of the problems we found is data collection is from a series of public and rural urban settings, but it could still be very biased. Because right now, DREV is unable to receive every single data from every single patient in every rural area. They are making their numbers mostly by estimations coming from the distributors' sales and distribution metrics. This can be very biased because rural areas may have less effective treatment due to the less technology there.
Now that we have a good overview of this product and how it works, let's take a look at some competitive technologies and how they differ from Brilliance.
The Lullaby LED phototherapy system is a technology developed by a USA company, GE Healthcare. The device utilizes LEDs which are mounted on a height adjustable rod to deliver the light to the baby located in the bed. The technology is used in Myanmar, which is a Southeast Asian country. Here, the GE Healthcare has provided local training and education programs to the locals. And the device is designed such as that it is suitable for clinics and homes. Also, this technology complies with goals 3, 4, and 17 of the SDGs, which are the good health and well-being, quality education, and partnership for the goals. Also, the device has a 50,000 hours lifetime, which means 6 years of continuous operation, and a $400 cost. The Billy Bed and Billy Combi is a technology developed by Medela, which is a Swiss company. The device utilizes a blue fluorescent tube, which is fitted into a plastic crib, and the final product is a suit where the baby is placed in and the therapy is actually occurred. The technology is used in South Africa and it is designed to be suitable for use in clinics and homes. The design also complies with SDG goals 3 and 4, which are good health and well-being and quality education. The lifetime of the device is 1,500 hours and the cost is $300.
DREV certainly faces competition from similar technologies in the phototherapy industry. How do they differentiate themselves? Let's take a look at Brilliance's financial model to understand how Brilliance is priced at just $400.
Obviously, apart from DREV's Brilliance, there are many other available solutions to jaundice. However, the case for Brilliance is made with its cost effectiveness, which is a product of its virtually negligible maintenance cost. According to studies done by DREV itself and Stanford University, the primary reason why 95% of devices used to treat jaundice do not meet current medical standards is their high cost of maintenance. Many of Brilliance's competitors utilize compact fluorescent bulbs, which usually last only 4 months per set. On average, these competitors require a set of 6 such bulbs to meet their advertised intensity. With a sticker price of approximately $15 US per bulb, replacing these bulbs when necessary would amount to a total yearly maintenance cost of $270. In comparison with its competitors, the LED lamps used in Brilliance last approximately 60 times longer than standard compact fluorescent light bulbs. This equates to being able to run one set of LEDs in Brilliance for approximately 20 years before having to replace them. If we look at a time frame of 20 years, Brilliance would only cost $400, which is the current price of the unit. In the meantime, its cheapest competitor, costing slightly less per unit at $350, would amount to a substantial $5,750 with bulb replacements over the 20-year span. When looking to obtain funding for Brilliance, two main funding stages were outlined by DREV, the R&D stage as well as the distribution stage. According to DREV's CEO, Krista Donaldson, there appeared to be four main reasons why obtaining funding was so difficult to get. Jaundice was simply not at the top of the priority list for many funders, who are more interested in tackling more commonly known issues like hunger and AIDS. Very often, funding organizations required academically rigorous and published data to be considered for funding. Both of these were very difficult to produce when researching jaundice, since many inflicted children are never taken to clinics and therefore are never diagnosed. Or the disease may seemingly disappear, leaving behind a disability which is seldom perceived to have anything to do with jaundice. Another reason is that the field is saturated with various competitors, as the solution space for jaundice appears misleadingly to be simple in nature, hence giving the false sense that the barrier to entry is low. And lastly, many funders were simply more willing to provide funding to groups with a prototype, a nice story, and a twinkle in their eye, rather than in a team that was actually working to develop a market-ready product. For the R&D stage, DREV decided to aim for a series of unrestricted grants from a number of smaller donors, instead of a larger grant from a single foundation. The reason for the choice is that in general, smaller foundations are more agile in nature, and in this case open the possibility to more funding if any unforeseen events occur in the future. For DREV, there were three characteristics that made smaller foundations more desirable. In smaller foundations, decisions can be made in a more timely fashion than in larger organizations, which require more paperwork and validation. These smaller firms in general are more flexible with their grant structure, meaning they can more easily increase or decrease their support where necessary, which was a necessity for DREV in case of unexpected challenges. And lastly, DREV found that smaller foundations were more willing to explore new and upcoming technologies to solve problems, whereas larger foundations restricted themselves more to traditional solutions. Once Brilliance was fully developed and ready for the market, DREV outlined a target market for its product before it began planning its next funding model. DREV wanted to impact as many lives as possible with its new product, so it set out to sell Brilliance primarily to district-level and larger hospitals that have neonatal intensive care units. These hospitals are the birthplace of a significant amount of children and are the primary care center that children diagnosed with jaundice are referred to. So naturally, these hospitals became the prime marketplace for Brilliance. With the target market set, DREV began investigating which funding model to pursue for the distribution stage. DREV recognized that it did not have any of the credentials necessary for handling the distribution of Brilliance in India. So as a result, DREV decided to license the product to Phoenix Medical Systems, an external distributor. Phoenix Medical Systems is a for-profit corporation based in India, which has strong ties and distribution channels for products related to infant and maternal care. In order to prevent price gouging, DREV established a price cap on Brilliance as part of the licensing deal with Phoenix Medical Systems. Additionally, a framework of incentives to sell Brilliance to DREV's target market were also put in place in the agreement, as well as numerous stringent quality checks to ensure compliance with medical standards.
We are now in a position to analyze Brilliance's strengths, weaknesses, opportunities, and threats, as well as the different impacts it creates in the community around it.
Brilliance's strengths include an energy-efficient LED array, which requires very little maintenance, making it better than traditional phototherapy equipment. It is manufactured locally, which is why it offers employment opportunities to local Indian communities. Its integrated design allows for its use in conjunction with other medical equipment. Its weaknesses include that it is expensive to replace these LEDs, and it is difficult to source them in rural Indian communities. At $400, it is significantly more expensive than traditional phototherapy equipment, which is why in high-volume clinics, it is more expensive to implement lots of these units as compared to traditional phototherapy equipment. Some opportunities for Brilliance include expansion to other countries and communities, as well as, due to the governmental LED program in India, rural Indian communities will see higher LED availability and replacement options as time goes by. Some threats include social and cultural non-acceptance, political and governmental setbacks, as well as competition from cheaper LED phototherapy technologies such as Firefly. The political challenge Brilliance faces is that the party in power provides greater support to local technologies. As Brilliance is designed in the USA, it may face some setbacks. Economically, Brilliance has several advantages as it has a longer LED lifetime resulting in less maintenance costs. The LEDs typically are more energy efficient, resulting in lower operating costs, as well as governmental supports and subsidies available for LED bulbs and arrays. However, the $400 base price is more expensive than traditional CFL phototherapy systems. Socially, Brilliance contributes to reducing infant mortality rates in rural India, which is great. It also furthers local employment opportunities as the device is manufactured in India. However, this creates a competitive disadvantage for the local medical technology companies in Indian communities. Technologically, Brilliance has some great numbers. Its LED lifetime is over 120,000 hours. It consumes less power and is more energy efficient. It withstands power fluctuation without affecting its performance. It has a movable frame, which allows easy adjustment and reorientation of light. Legally, Brilliance models are all certified by the CE 0843 certification standard. Environmentally, Brilliance is great as its energy-efficient LEDs contribute to reducing the coal-generated electricity, which is dominant in India. However, these LEDs also contribute to high electronic waste with its concentration of dangerous metals, which have negative environmental impacts. This is especially bad as rural Indian communities pollute their rivers and lakes with waste constantly. Almost 90% of newborns have some form of jaundice, and approximately 1 in 3 phototherapy devices have at least one bulb missing. Therefore, it can be concluded that there is definitely a demonstrated need for a new technology. A $400 upfront investment results in $240 of annual savings. Over 5 years, this can be considered a relatively inexpensive product. LED arrays are difficult to source in rural Indian communities, which is why this technology is not very well maintained locally. This product can be considered highly durable because of its 1-year warranty and 120,000 hours of LED life. Brilliance has definitely proven effective as it has helped treat over 370,000 newborn babies and is employed in almost 50 countries. Based on the above factors, it can be concluded that this technology is in fact appropriate in the Indian society.
After a more in-depth analysis of Brilliance, it can be concluded that DREV is unlikely to meet its goal of eliminating the effects of jaundice worldwide by 2022. The primary reason for this is that while Brilliance will improve the treatment of jaundice in India, it does not extend its reach to the people that need it the most, particularly in extremely poor communities and those that are in very rural environments. To move forward, Brilliance's next steps could include integrating local talent into upper management and higher level design for future products, kickstarting jaundice awareness campaigns, testing, and diagnosis programs in local communities, creating comprehensive procedures to collect patient recovery information, investigating scale-up options such as expanding the cradle design to treat more than one patient at a time, improving modular upgradability of Brilliance units. One way this can be achieved is by allowing treatment facilities with older Brilliance units to inexpensively upgrade their devices. Decreasing the price point even further to extend the product's reach into poorer and more rural regions. Working with the government's energy divisions to make LED replacements more accessible. We believe that with the above recommendations, DREV and Brilliance will benefit greatly and move forward in achieving their goal by 2022.